Thank you for being here today. My name is Brandon Sullivan, and I am a research student with Fisher College. I am here today to discuss mandating a COVID-19 vaccine for all healthy adults without an exempt medical condition. The main reasons for forcing a COVID-19 vaccine is to prevent thousands of lives from being lost, prevent hospitals from being overwhelmed, prevent society from shutting down. To get back to normal, we need to have the population vaccinated against this deadly disease. It is only natural for us to want to preserve life and health as much as we can. By getting this vaccine, we can prevent further deaths in the United States. According to the CDC, there have been 560,000 deaths in the U.S. due to COVID-19 as of April 13th, 2021. Not included in this statistic are the people who have spent months on ventilators, have had to relearn to walk and care for themselves, and people who have lifelong cardiac and neuro complications. Now, let's compare all those people who have lost their lives and have permanent disabilities to the rare rates of severe adverse reactions to the COVID-19 vaccine. According to the CDC, rates of anaphylactic reaction are between 2 and 5 people per million, and almost always occur during the first 30 minutes after vaccination. Additionally, according to the CDC, there have not been any proven deaths due to the vaccine. As you can see, the risk of side effects from the vaccine are minimal. The most common reason for people to refuse the vaccine is due to safety. As I stated above, the rate of severe, life-threatening complications is extremely small, and there are preparations in place to deal with them when they arise. People are forced to wait for a period of time after getting the vaccine to assure that no anaphylactic reaction takes place. Additionally, if one occurs, there are trained medical professionals that are ready to react and treat the complication appropriately, preventing any death or permanent complication from the vaccine. Other complications are relatively minor and include pain at the injection site and flu-like symptoms, like a runny nose, some achiness, maybe a mild fever. The other common reason people are declining the vaccine is skepticism of its effectiveness. The questions people have about its effectiveness can be answered by the company's trials. According to Yale Medicine, the Pfizer vaccine was shown to be up to 95% effective, while Moderna was about 90% effective. Now, many people argue that they are at low risk for serious COVID-19 complications, but they are at risk for another impact of COVID-19, and that is economic loss. According to the Bureau of Labor and Statistics, the national unemployment rate in the U.S. went from roughly 3.8% in February of 2020 to a high of 14.8% in April of 2020. Additionally, many people who were not laid off saw their hours drastically cut. Many small businesses did not survive, while others saw drastic drops in their revenue. With mandated vaccines, we can get people back to work and prevent further economic decline due to this virus. In the United States, having access to emergency medical care is a right that sometimes we don't think about. COVID-19 put this ability to have access to emergency hospital care at risk. Hospitals were flooded, ICUs became packed, and many hospitals struggled to keep up. During this time of national crisis, hospitals risk getting to a point where they have to decide which patients to treat and which patients to send away. Imagine your 90-year-old grandmother got appendicitis and needed emergency surgery, but she was turned away because the hospital was full and she didn't qualify due to her age. This is something that we have never had to consider before, but COVID-19 brought us to the brink of this. This is something that occurred in many other countries, and hopefully we will never have to see here. I would like to end by giving you a personal anecdote. In May of last year, a coworker of mine, a 54-year-old female and a longtime nurse, contracted COVID-19. She survived the illness, but now suffers with debilitating cardiac complications in which her heart rate spikes up to the 200s with minimal movement and drops to the mid-30s when at rest. She is unable to work and struggles with day-to-day activities. Doctors have been unable to find a successful treatment for it. We need to force the COVID-19 vaccine on adults without medical exemptions to prevent deaths, disabilities, and severe economic loss. Thank you for your time.